Okay, so most of you enjoy your work, and 10 of you are not currently working. All right. So can you go to the next question? Are you on in the next question?
No, doctor, is loading still.
All right. Okay, looks like great. Still going on. Never mind. We just wait until the thing stop. Okay, great. So looks like most of the time what you are doing is basically you're trying to gain knowledge and get to learn more. That's good. So the important things that is not you are not here to get a certificate, and not here to get a certificate is the main thing. Certificate is just a added benefit for you to attend a master's course, because you need to understand that certificate alone would not improve what you're doing. But the main point is that you need to look at it and get a what we call uh, knowledge is what is important. All right. So let us continue the class today. Okay. So in Malaysia, basically occupational health is not a new field. All right. So occupational health has been here since the early days. So basically, when we taught our medical student long time ago, all right. So what we did is we asked them to go and look at occupational health, all right, and then look at it from how the occupational health actually. But so it started long time ago. You look at the picture. The picture is taken by our student, and actually it says that whether the welding we carry out at a sawmill, you know that only a pair of ordinary glasses are used to protect the workers. So basically, it shows that they are actually focusing on occupational health also, right? So what is OH? All right, OH is basically the promotion and maintenance of highest degree of physical, mental, and social well-being and workers in all occupations. So the idea is that it is not just talking about preventing disease, preventing injury or preventing diseases. You're also talking about the promotion, maintenance of physical and mental and social well-being. So from this actually, if you learn some if you after we have taught you in this course, you will know that it's more than just safety and health. Basically, it's more towards improving physical and mental and social well-being. So what is basically the WHO and the ILO definition is basically to prevent departure from health, to protect workers from risk from health, and the risk can be psychological or physiological risk. All right. So it's not just physical risk, but it's not just a risk that you get basically from exposure to hazard, as physical hazard, but also looking at it from the psychological perspective, which is basically mental health. So mental health is a kind of a psychological risk. All right. So and the summarize is basically about occupational health. It's about adaptation of a work to a man and each man to his job. So basically, how can we change, adapt the work so that it fits everybody, and that is the problem of basically occupational health, to fit everybody, because everybody is different and everybody have different ability. So we need to also understand how can we fit everybody into a workplace, and how can we basically ensure that people working in that area are competent enough to work. So that is what we need to focus on. All right, as in occupational health. So the objective is to appreciation and the social, economic, and administrative needs, and also responsibility of workers and the employer. So why occupational health? Okay, so the overall picture that emerged from all aspects developing and increased health and safety risks. Okay, so there's increased health and safety risks. Just, just can we ask you? Can you when I click here? All right. Can you see me? Okay, you can see me. All right. So the overall picture is to emerge that all parts of the developing world is one of the increased health and safety risks, and also because of globalization and population growth will affect the global economy. So the idea is how can we basically identify issue affecting the health of the population, and how can we look at it from not just the local perspective, also from global perspective. How can we prevent people from getting sick and when they are going to work. So how bad is the problem? So this estimation is basically for the past 10 years, nothing much have changed. So there are estimated 2.7 billion people working, and at least 2 million deaths per year attributed to occupational disease and injuries. All right. So 2 million people die because of occupational disease and injuries, and there's actually more people dying from occupational disease than from occupational injuries. And of this, 4% of the gross domestic product is lost because of this injury and diseases. And also 25 million DALY also is lost. DALY is disability adjusted life year, which means that for every time you get sick, all right, for every day you are on MC, or every day basically you come to work but you're not performing 100%, this is called disability. So when you are disabled, and then basically there's what we meant by there's 25 million day lost because of disability. So that is important, not just, and that leads to 4% of gross domestic product loss, and not just looking at the 2 million people who died from occupational disease and injury. So worldwide, 160 million people who have work-related disease and 260 million work-related accident, non-fatal and fatal. But you look at it from the information, there are more people dying from work-related disease or occupational disease than people from injuries. So there's 2.4 million deaths caused by work-related disease, and only 380,000 people die because of injuries. So work-related disease itself is important, but a lot of times when we're talking about occupational safety and health, we don't focus on work-related diseases, and we don't understand what is work-related diseases. But I think over the past 2 years, because of the COVID-19 pandemic, a lot of you have understand what you mean by occupational diseases, and how can you, and occupational diseases is something that come into our mind. Although when we say that when you're exposed to COVID patient, when a healthcare worker is exposed to COVID patient and the healthcare worker get COVID, so although it can come, it can be a diseases, but sometimes you also can consider it as an injury. But we need to understand, is this patient die of the disease, which is COVID-19. So basically, people die of occupation disease. So from the 2017 statistic will change in 4 years time, when basically when new statistics come out, maybe next year 2022, which includes COVID-19 death from people who is basically occupational related diseases. The financial burden have not changed since many years. It's still 4% of the global GDP loss, but countries in developing countries is basically much more, can be up to 10% of gross domestic product. Gross domestic product means that the money we basically spend, all right, not just the money you produce, but also the money you spend. So gross domestic product can be money, the what you produce and also what you spend. So that's gross domestic product. That means you lost the income and you cannot spend the income, and also you lost productivity and you cannot produce. So that's called gross domestic product. So it's quite a big amount of money lost because of occupational disease and injury. So by preventing occupational disease and injury, you'll be able to improve the health status of the country, the population, and also the workers, and basically improve the productivity. And that is important. By understanding how to perform well, basically you can improve productivity. So as you see this picture, you know that because of COVID-19, because of the global lockdown, because of so many things that's happening, the 2020 economy, there was a predicted 5.2% contraction, and Malaysia in June was predicted to have 3.1% contraction. But at the end, we have basically 5.6% contraction because of the extra, or because of the extension of the lockdown, due to the issues that happen because people are not following the SOP, and because of activities of certain parties that leads to this GDP contraction. And from September until December, where our country is basically in a complete lockdown, that's why our contraction was worse compared to the predicted in June. So that is important. So the idea is, if we have actually focused on safety and health, focus on ensuring that everybody look at it from the risk perspective, safety perspective, we would have prevented the third wave, which is basically because this is because of the Sabah election, and we know it's because of the Sabah election, and we know why is the Sabah election. It's not the election itself, but it's because of people from Semenanjung Malaysia or Peninsular Malaysia going over to Sabah to actually campaign during the election, and they bring back the COVID-19 to Peninsular Malaysia, where at the time the number of COVID-19 cases in Peninsular Malaysia is low, but the number of cases in Sabah Sarawak is high, especially Sabah. So that is the thing that we learn, and that is the thing that we need to learn. But even before the thing happened, public health specialists, safety and health specialists has actually given the warning and things that this thing is going to happen, and you need to basically focus on that. So that was already there, but the people are not being basically following it because they're not caring. So the idea is not just having the knowledge of safety and health is important, but also having the knowledge of how to communicate safety and health, how to sell safety and health, how to ensure people understand that safety and health is important. So what we want you to do as the safety and health practitioner of the future, you are the future of Malaysia. You need to be able to focus and understand how to basically convince the government of the time, the ruling people of the time, importance of safety and health. Not just that, but also talking about from the perspective of occupational or company. All right, we know that many companies close down. Many companies needs to close down because although they focus more on productivity instead of focusing on providing the correct safety and health for the company. And I think we have some of you here who is basically working in big companies, and you know why you have closed down or for the short period of time or lockdown because of COVID-19 outbreak in your company. So before 2019, a lot of people were not basically concerned about biological hazard. But currently, biological hazard become a problem, and I think for you all as a safety and health practitioner, you need to learn and need to understand how biological hazard contribute and how to actually safety and health actually is important in all these perspectives. Of course, we know that the economy continues to suffer, and the certain sector basically suffer more than certain sector. Manufacturing sector, usually there's not much problem, but the service sector actually is suffering. And one of the economists have said that the service sector suffer more because a lot of people are afraid to go out, to spend money, to go for touring, to go to tour, to go to eat in a restaurant, and to spend money for services. That's why we have a lot of people buying a lot of things, and that's why the manufacturing sector are still working and still producing, but the service sector are basically suffering. Or your restaurant, or your airline, or your tourist spot, all of them are suffering. So it continues to suffer because of the spending habit have changed because of COVID-19. So it's important for us to basically understand that we need to look at it. Occupational health is basically, safety and health is not just about safety and health alone, not just about knowledge alone, but also about understanding how this information, how this actually come into the whole scope of your issue. All right, so that is important that you need to understand. And this is 2 days ago, 180,000 healthcare workers may have died because of COVID-19. All right, so between 80,000 and 180,000 healthcare workers may have died because of COVID-19. That's what the World Health Organization said. In Malaysia, also we have many healthcare workers dying, but the number is basically much more smaller than the rest of the world. And in University Malaya Medical Center, we don't have any healthcare worker who has passed away because of COVID-19, because of COVID-19 exposure in the workplace, exposed to patient in the workplace. This is because we have very, very early on, since January 6th of 2020, we have basically set up our task force, and we have our first meeting on 6th of January, and we have a first meeting after the first case came to Malaysia. That was on 25th of January 2020. There was the first case, and we have our meeting on the 26th of January 2020, which is basically the second day of Chinese New Year, where we basically have a meeting in University Malaya Medical Center to look at safety and health, and to make sure that the safety and health are in place, and to make sure that all our healthcare workers continue to work. So you must understand that because of the safety and health measures that was taken by us at that time, our hospital don't have any closure. Even though if there's an outbreak, it is controlled, and we only close certain ward for 1 to 2 days to actually sanitize the ward. We don't close the ward. We don't close the ward down. We do basically what we call isolate the patient, but we don't close the ward down. The ward still function, the people still working, everybody is still there, but we do provide the measures that we look at it from. So we not just providing measures like what we call safety and health measures like your PPE and your other things, but we also provide psychosocial support. We have a psychosocial support team that basically will call up people who has been positive, who has been exposed, who are on quarantine, and ask them how they are. So we have that. So the thing about occupational safety and health is not looking at just a narrow scope, but looking at the overall importance of ensuring the mental, physical, and psychosocial well-being of your workers. That is what is the what ILO and WHO have said, and that's what we need to follow. And if you follow that in your workplace to ensure that your workers actually are taken care of, your workplace will continue, and there'll be no shutdown, and there'll be no major issue, and you wouldn't lose money because of that. And we actually did not have any day shutdown of the hospital or even a ward for more than 2 days. Usually we shut down a ward for 1 or 2 days to actually just to clean it. After that, we open it up back again, and we allow the patient to admit again. So we quarantine the people, but because we identify, we do risk assessment, we do things like that. It basically it is important that we don't have any major problem, and we don't have any death from COVID-19 directly from exposure because of to their patient or because of their process in the workplace. So that's important and to understand, and that's because we have in place occupational safety and health measures very early on in the COVID-19 pandemic. This is because we understand what is it, we know how to do it, and that's why we can do it correctly. Sometimes we do things different from what MKN asks us to do. We do things because we are frontline and we need to basically ensure our workers continue to work. So we are a little bit different from when we're talking about from MKN. So this is just repetitive, so we can just skip this, all right? And look at lung cancer, all right? This is just to show you what are the lung cancer and leukemia, causing leukemia. This is COPD. COPD is chronic obstructive pulmonary disease, and asthma. These are all lung diseases, all right? So, and how much actually it costs the people dying from chronic obstructive pulmonary disease, people dying from asthma, and what are the DALY loss? What are the basically at the end? How much of it is due to the whole what we call attributable risk of occupational diseases? Right, these are all occupational diseases only. These are not other diseases. These are basically people getting chronic obstructive pulmonary disease, people getting asthma from exposure to a chemical in the workplace. We know there's a lot of chemicals in the workplace, a lot of hazard in the workplace, and people can get COPD and asthma. Not just chemical, but also any other physical substances or other chemical substances. We should learn later. Of course, musculoskeletal disorder was also a problem. Back pain is a problem, and a lot of people get back pain. And currently, if you are sitting in your computer, especially your people working from home, you would get back pain because of your prolonged sitting computer. The other thing that you're going to get is you will get eye strain, basically because you're always close to your computer. Hearing loss is a major problem in Malaysia, and we have basically a lot of people having hearing loss problem. So this is just to look at it from the attributable perspective. How many percent of the occupation, how many percent of the diseases are attributed to occupation? So back pain is the most, all right? Then hearing loss, COPD, and asthma, unnatural injury, trachea. This means that every 100 people getting back pain at the workplace, 37 of them are basically due to work. Every 16 people getting hearing loss in the workplace, all right? So every 100 people getting hearing loss in the workplace, 16 people are due to occupation exposure. Every adult, getting hearing loss. Every adult having COPD, 30% of the COPD are basically due to occupation exposure. Same for asthma and unnatural injury. So the idea is that if you can actually reduce, identify these factors are basically 100% preventable. It's called a preventable disease because if you don't work, you don't get the disease. But if you can identify the hazard early, your workers won't get the disease, and basically it will improve your productivity. All right. This slide actually just shows the occupational disease notified to DOSH. So if you look at it, these are the diseases notified to DOSH from 2015 to 2016, from occupational skin disease, occupational lung disease, occupational musculoskeletal disease, occupational disease from biological agent, occupational disease from physical agent, occupational disease from psychosocial agent, occupational cancer, other occupational diseases, and finally, noise-induced hearing loss. So noise-induced hearing loss is one of the major occupational diseases in the country, and it is because of there were around 9,000 cases in 2019 of people having noise-induced hearing loss. So noise-induced hearing loss is the most common occupational disease notified to DOSH. When you look at occupational disease cases compensated by SOCSO, so occupational disease by biological agent, occupational disease by chemical agent, occupational skin disease, occupational lung disease, occupational hearing loss, and occupational musculoskeletal disorder. So occupational musculoskeletal disorder is the major disease compensated by SOCSO over the years. All right. It was basically occupational lung, occupational hearing loss, but currently there's more MST being compensated because more people know that you can actually get compensation from if you are getting a musculoskeletal disorder in the workplace, and more people actually claim for that. But it's important for you as a safety and health practitioner to be able to develop programs to do ergonomic assessment to prevent occupational musculoskeletal disorder. Although sometimes it's difficult because it is very, very individualized, but that is the thing that we want you to learn, want you to see how to actually reduce occupational musculoskeletal disorder. It is a major issue when you look at it from the compensation perspective. It's the major issue when you look at it from the global perspective, and it basically this is 30% of 37 cases of every 100 cases of musculoskeletal disorder among adults are due to occupational exposure. So that is important for you to understand, right? So almost 40% of the cases of back pain that we see in the hospital are due to occupation. So how can we reduce that? Because we understand occupational disease is a preventable disease. We need to identify risk factor and how to reduce it. And also we need to look at it from many perspectives, especially from your industry, from your company, what is important of you to reduce, to identify risk factor or hazards for occupational diseases and prevent occupational diseases. So we know that because labor is significant, and I think this one we can skip, and we know that if you have improved occupational safety and health, then actually your competitiveness actually increase, and this graph actually show it, all right? So that if your competitiveness actually increase because of you have better safety and health measures in the workplace. So what is OH? Basically, occupational health is health at work, all right? That means how can we ensure that people coming to work are healthy, people coming to work don't have any diseases. So that's important, especially currently in the time of COVID-19. We want to make sure that the workers come to work are healthy and don't have COVID-19. So it's healthy people coming to work. And another way is health problem arising from work. Look at health problem. What are the problems that we see from workplace? The next thing is look at how work can actually affect your health, how work can actually reduce your health, how the hazard in the workplace can be prevented so that you can improve health in your workplace. So health effect on work. And so poor health can affect work, correct? Poor health can affect productivity, can reduce innovation, especially people in the research area will basically understand that if you have poor health, you cannot think properly, you cannot innovate, all right? And it increase sickness absenteeism, increase turnover rate, and increase accident rate. And also poor health, also what we call, it promotes presenteeism. And presenteeism means that you come to work, but you are not performing 100%. It's called presenteeism. You come to work and you cannot do your work properly because you are sick, either physically sick, or mentally sick, or psychosocial problem. So it's important for us to look at it from a global perspective. So what's the aim of OH? Protect and promote health of workers, develop and promote healthy and safety and work environment, enhance physical and mental and social well-being, enable workers to conduct socio-economically productive life. Right? If you look at it, what we are doing is we are focusing on the workers itself, and the workers is our main asset in any industry, in any organization. The workers is our main asset. If the workers are sick, your productivity will come down, and that is also, if the workers are sick, they cannot project a good image for your company. So that is important for you to have workers that are healthy. And if your workers get sick and get your company closed down, your company get to lock down because of this COVID-19, we've seen many times, your company will basically, image of your company will come down. And that is what we are seeing also in many industries. So what do we do in occupational health? We look at prevention. It's important. We identify what are the risk factors, we identify the hazard, and we try to prevent the hazard so that the disease does not occur. And also we look at diagnosis and treatment of occupational disease. So as a safety and health officer, what is your role in diagnosis and treatment? Your role in diagnosis and treatment is that your role is to be able to identify a worker who is maybe have occupational disease and then discuss it with your doctor. That is your role as a safety and health officer. Of course, you're not a doctor, but because we teach you enough basic knowledge about safety and health, about diseases, you have a basic understanding of what can be considered occupational disease or not. You don't make the decision, but you identify it and you basically discuss it with your safety and health team. All right. Prevention and treatment of occupational injuries, organization health services for workers, including first aid. So all these things are part of your role of occupational health in your organization. We also focus on mental health at work, as I mentioned earlier. During the COVID-19 pandemic, University Malaya Medical Center very early on set up the psychosocial first aid. All right, we do psychosocial first aid. We make sure that we have a psychosocial team to ensure that people who is basically has been exposed to a patient will be given counseling. People who is on quarantine will be given counseling. People who's been got on having COVID will be given counseling, and the counselor will call them out to assess them and see how they are, how they feel. This was very early on. This was in February, in March, when we have cases coming in, and at that time there was a lot of people basically having bad communication and bad not treating people who are positive with a positive stance, but basically isolating them. So we need to basically counsel. So we don't counsel only the workers, we also counsel the family, right? Of course, then we have promotion of healthy working environment. You know that if you have a healthy working environment, if the environment is healthy, basically you're more productive. And we look at rehabilitation. Rehabilitation is early on. We identify workers who basically have occupational disease or have problem, we rehabilitate them so that they can go back to work early. And the rehabilitation, if you talk about Psychosocial, basically they work together with the workplace to ensure that people go back to work early. And the main thing is prevention of illness and promotion of health. So the workers is important. We always look at the workers. We first focus on the worker. Then we look at the tools and equipment that is being used. And we look at the processes. Basically, these are standard operating procedure, all the things that are being done. We focus on that, look at it, how much of that is actually can be improved. And look at the work environment. Like currently, when we talk about work environment, everybody's looking at ventilation. Ventilation is important. We know ventilation is important long time ago, and the COVID-19 actually have re-emphasized that ventilation is very important in any work environment for us to prevent not just occupational disease, not just occupational diseases like COVID-19, but also other occupational diseases like your respiratory diseases. So when you look at it, everybody coming to work are not the same. Some of you are healthy, some of you have pre-existing disease. But no matter whether you're healthy or pre-existing disease, we want to make sure that the workplace would not make you worse. We continue to continue to have the same health status or better health status when you come to work, before you come to work, and after you come to work. So the workplace can be anything from a factory to an office building to even a mobile car. Like currently, we have a lot of people doing Grab or doing basically online contractual delivery, either Grab, Panda, Food Panda, or Lazada food. Basically, they are basically delivering food or mobile. That are basically, those are also need to be focused on. How can we reduce psychosocial health? How can we look at psychosocial health issue among the workers? So it's simple. Occupational health is health and work. All right. How does health affect the work? And how does work affect the health? So health and works. With COVID-19, we understand that unless you are healthy, you should not go to work because it will affect the workplace. All right. So that is important. And then we look at what actually affect health. Can be genetic factor, can be what we do, all right, habits, can be what we eat, can be social economic factor, all right, or psychosocial factor, and the environment, all right. So those are the work factors that are basically those are the factors that we have to look at from an individual perspective, not just from workers. So when we look at workers per se, we're looking at healthy worker, we have no diseases, then we have latent disease, then we have clinical phase of disease. Latent disease means that they have a disease, but there's no sign and symptom. And it's so important that we understand that. Like currently, when we talk about COVID-19, it's so simple, all right, for us to understand that, because in COVID-19, we have people have COVID positive, but they are asymptomatic. They're healthy, asymptomatic, but they are carrier. And that actually can affect other people. That actually can spread the disease to others. So, but that is just on COVID-19. But also there's many people who have diseases but does not show sign and symptom of the diseases. That's why we need to do medical surveillance. That's why we do medical surveillance, because medical surveillance are when we survey when we do surveillance on the workers at risk, and we'll try to identify early sign of a disease very early, which might not be easy for them or might not have developed yet. So we try to identify early sign of diseases. That's why we do medical surveillance. That's why it's important for us also to look at medical surveillance. To work on health. Because we look at health on work and also work on health. So both are important. So when we work on health, we're looking at the workplace, the type of work. How would the workplace or the type of work interact with the health and affect the health of the worker? It's called work on health. What is the effect of a health place? Like, what's the effect of dusty environment on the health of the worker? This is basically, this picture shows you a milling factory in Kelantan. It's a rice milling factory, all right? So when you do rice milling, all right, what's the effect of rice mill dust? Can it cause asthma? Can it affect the heart? Can a person with asthma work in a dusty environment? Can dust make the asthma worse? Can a person with heart disease work in a dusty environment? Can the dust make the heart condition worse? What else besides dust in the workplace that can cause asthma? What else besides dust in the workplace that can make the condition worse? Dust is just one of the hazards that we identify. But what other hazards are there that actually can cause the workers to have worse off? Right? So what is the effect on health? In occupational health, we are concerned whether or how the job actually affect the health. So we look at healthy people, latent disease, clinical disease, and death. So what we want to do is we want to identify latent disease. We want to promote healthy to ensure people stay healthy and don't go to latent and clinical diseases. And then death. This scenario, if you look at it from COVID-19 basically is very clear, and it's not, you don't have to think so much and explain much more in detail. Health on work. What's the effect on the health on work? How does a pre-existing condition affect the ability of the workers to perform his or her job? Like the job itself, it depends on the workers. All right. Are you a pilot, office, a person working in the office, or a delivery person, or a bus driver? What is the effect on health on work? How does the heart disease affect the worker's ability to work? Okay. So can he drive a bus or not? Can the workers drive a bus? Can the worker drive a school bus or not? Right. If the worker can drive a school bus, right? And the same thing, same disease, can the person fly or not? Right? Although you're having the same disease, same problem, but the idea is that because you're working in a different environment, your assessment is different, and your heart condition will mean different thing. So it's not just that because you have heart condition, you cannot work. You still can work, but we need to place you in the workplace that are suitable for you. So by understanding this issue, by understanding pre-existing health condition, and you can basically consider different type of job that the person can be suited for. The basis of occupational health is health. The work should not be harmful on the health of the workers and the workplace. And also health on work. A worker should be fit to do his job and should not impede on the safety of the job, work, or workers, client, or public. So that is the main important. So you must be healthy when you go to work. What are the issues and challenges of a healthy workplace? All right. So function of a health and safety engineer. So what is your function if you're a health and safety engineer? All right. So you promote worksite and product safety, apply knowledge of industry process and mechanical and chemical human performance using specialized knowledge. All right. And what's the function? You can read this later, and you can understand what's the function. If you're an industrial hygienist or a chemical engineer, what is your role? And we'll talk about chemical engineer. We have a lot of chemical engineers here with us. So you would basically have a good understanding of chemistry and good understanding of chemical process and good understanding of the hazard of a chemical. And that basically gives you an advantage when you talk about understanding chemical, because most of the time when we talk about exposure in the workplace is either agronomic issue or chemical issue. So we look at dust level, ventilation level, noise level. So we also look at ventilation. Ventilation, is it a mechanical engineer problem? All right. But the issue about safety and health is that you are a mechanical engineer, you are a chemical engineer, you are a civil engineer, because you need to know all the things that is happening in the company itself. You need to know ventilation, although you don't do ventilation, but you need to know how ventilation works. You need to know chemical. You need to know how the chemical process works. You need to know the structure of the building to make sure that electrical, you need to ensure that there's no fire, things like that. So everything comes into place when we talk about safety and health. But of course, you can't know everything. So usually safety and health work in a group. But as a safety and health executive, you need to know who you want to be part of your group. What is the ability of the person that you want? And that is important. That's what we are going to try and teach you in this safety and health course. All right. So we have also radiation control specialist, we have industrial safety engineer and manager, right? So that comes down to the safety and health or occupational health component of the course of the lecture today. Is there any question before we continue to the next part? Is there any question?
No, doctor.
All right. Are you all clear? Are you
Yes,
clear?
Prof. Clear.
Yes, clear, doctor.
All right. So you understand. You basically, this is an introduction, and then we want to focus on the next one, environment. What is environment? All right. What is environment, and why is environment important in everything we do? All right. So what's environment? Okay, let's go to Menti again. We'll go and focus on Menti. All right, we come back to this, then we see what's happening. All right. All right, there's 26 of you who have responded. The rest, are you going to respond? So we have 26 responding, 27, 28. Anyone else? We'll give you another 10 seconds. Okay. 5, 4, 3, 2, 1. All right. So everybody thinks that, okay, I think environmental health is about sustainability, about clean air, about pollution, about human health, about global warming, about safe ecosystem, about flora and fauna, green space, health of from the surrounding. All right. How the environment affect us, clean water, well-being. Very good. Now let's focus on the second task. So what's the main environmental health issue in your country 20 years ago? Okay, we have people from China, I think. two people from China. So maybe people like China and also Malaysia. We saw from people from various part of Malaysia. So what was 20 years ago? What was the problem? All right. This is not now, 20 years ago. So what was the problem? And what do you think they're going to be the problem in the future? So haze, water pollution, deforestation, air pollution, global warming, river pollution, clean water. Right, clean water is related to water pollution, or is it different? All right, food safety, very good. Food safety is a big issue. Air pollution, sea pollution, climate changes. All right, so very good. So basically, it's almost the things that you see now. All right, also you see 20 years ago. You might be seeing the same thing 20 years from now. So the idea, what went wrong when we are seeing the same thing over and over and over again? So what went wrong? How can we progress? What are we supposed to do? All right. So things like the things that we need to discuss, and we need to look at it. What is it, and how actually are we trying to solve this problem? Okay. Okay. So we have done this. Let's go and do. All right. So 1957 is where we got our independence from the British. All right. So previously Malaysia was ruled, Semenanjung Malaya, or Malaya was ruled by the British, and then 1957 we got the independence, the 31st of August 1957. But during that time, actually, basically, these are the things that we look at. We look at the problem of what we call that latrine, or what we call sanitary, or not sanitary. What we call that? Yes, water treatment plant and things like that. All right, or sanitary or indoor water. All right. So sanitation is a problem. So how can we have clean latrine? And what's the issue with latrine? All right. So we have drop latrine. We have basically pit latrine. We have forest people doing business in the forest. And also, what is this? Anyone knows what is this?
Clean water, is it? Clean
Who
water
said
supply? Adam.
Adam?
Yeah.
No. Adam. Read first, Adam. Read, Adam. Anyone else?
Is it to collect the waste?
What
The
waste?
The wastewater.
What wastewater?
Um,
What type of wastewater?
Sewage wastewater, Prof.
Yes, sewage wastewater is bucket latrine. All right, you know bucket latrine? Have you seen bucket latrine before? I don't think we have seen it. No, none of us still have are old enough to see bucket latrine. All right. So if last time, even in the 60s, 70s, even the 80s, if you go to small town, all right, there's still bucket latrine there. Bucket latrine means that there is a bucket underneath your when you do your business, and then someone will come and collect the bucket at night and then empty the bucket, and then when the bucket is put into this called bucket latrine. So basically that's what it do. This is basically you pour the thing in front, and then after that you throw this whole thing into your not sanitary landfill, but into your sewage treatment plant, and then that's where you. So it's called bucket latrine. So this is one of the old picture from Alostar. All right. And these are the different type of latrine we have. So bucket latrine, this is called bucket latrine, when there's a bucket behind, and we just take the bucket out and we just remove the bucket, and basically this is the bucket latrine. So we have different type of latrine. All right. The main thing is basically why we do different type of latrine. What's the reason we do different type of latrine? So these are just to show you. All right. You don't have to understand. Of course, we look at where we wash our clothes, where we take out the water, where we do. So water basically is very important, especially river water. So what's river water used for? What's river water used for? What's the use of river water?
Doctor, domestic usage.
Okay, river water can be used for domestic use. Basically, river water can be used for two. Actually, can be used for drinking, and drinking water can be used for washing, can be used for recreational. All right. So all these things happen in the river, and basically, if you don't manage the river water well, also there's other organisms that reach in the that is in the river, like your flora and fauna in the river. All right. So all those things are there. Your aquatic animals are in the river. So if you have a clean river, if you pollute your river, then it will happen that the problem will occur. All right. So these are some of the pumps that is available for clean water. This is the issue of what we call picture of a kitchen showing when we talk about solid fuel. So what is the problem with solid fuel? Solid fuel, actually, the main problem is your particulate matter. So if there's a pollution, there's air pollution if you use solid fuel. So what is solid fuel? Solid fuel, basically, wood is a solid fuel, charcoal is a solid fuel. So those are the two solid fuels that you have. All right. So what's the main environmental issue in 1927? Safe water, safe sanitation, clean air, which is some of the things that you highlighted just now. All right. And some of the things that you're going to have it in the future. So the idea of when we talk about environmental health, what are we focusing on? What are we trying to do? What are we trying to achieve? Of course, we have people who's basically from the environmental consultant. We have few environmental consultants here. So maybe the environmental consultant can tell me, what are you doing in your company? What are you trying to do from the environmental health perspective? Not from other things, but more from the environmental health perspective. What are you trying to do? Doesn't matter, not the environmental health, also anybody else. Okay, when you conduct something, when you do something, what are you trying to do? All right, as a from environmental perspective, as a company, all right. Maybe someone. Sorry, yes.
Yes, Shilim here. I think the most important thing is to raise awareness and also give general information or some knowledge to the people for the future.
All right. That is basically NGO, the work of an NGO. All right. I'm talking about the work of environmental. You're consultant, is it? Environmental consultant.
No, fresh grade in environmental engineering.
So you are what we call those people still like have not get the real problem that is basically.
Yes.
I think you need to learn more. All right. I think that, but the environmental consultant, basically they have a lot of issue, and they would not be. It's not be nice for me to basically put them here on the pedestal and try and make them feel bad. All right, because that's not what we're supposed to do. We're supposed to learn and we're supposed to improve. All right, let us move on. All right, no worries. All right. So what happened actually in the 50s? Why is that water issue? Why is that safe water? So what is chlorination? What does chlorination do? What's chlorination? What's chlorination? Mutu Verapan?
Hello, doctor.
Yes, Mutu Verapan. What's chlorination, Mutu Verapan?
Oh, chlorination. There's a presence of chlorine in the water.
So you look at it. You look at the city of Philadelphia. You look at this graph. You look at the city of Philadelphia. They started filtration. All right. So what type of filtration do you use when you talk about filtration in your water treatment plant?
Activated carbon.
You are using what? What type of water treatment plant do you have?
From semicon manufacturing.
Oh, okay. You're not working in a water treatment plant for consumer water, is it?
No. For specific industry.
Okay, for specific industry. So you use membrane filter lah.
Yeah.
All right. So it's different. All right. So they use membrane filter. So he might not understand. He might not be clear on this. Maybe Shalin, you can answer
Yes,
this.
Prof.
What type of filter did they use for treating consumer water?
I'm not really sure in the industry.
It's not industry lah. This is basically part of environmental. This is not in the industry. This is in the
Okay.
in your lembaga air, in your water.
Normally, I think.
It's not industry like what
Okay.
Mary Verapan is.
Maybe I try to give an example. For example, like the main function of the filtration is to filter out those rubbish or anything from the water source. Maybe it's just a normal primary filtration,
All right,
like
so
grid filter, something like that.
grid filter. Okay, they have a grid filter. Grid filter is basically the first stage lah to make out the big filtration. But there's two type of filtration used in water treatment plant. It's the slow sand filter and the fast sand filter. All right. So we use sand as a filter. All right. Of course, you still use sand as a filter. If you buy a filter in your house, there is sand inside. So like different grade of sand. So you use sand filter. Of course, the best is use a membrane filter, like what Singapore use. Singapore use membrane filter. All right. So you filter up. So basically there are filtration status. After that, after the filtration, only you put chlorination. Why you need to filter out, and also you need to do flocculation also. So chlorination is basically one of the last step before actually the water goes to the consumer. So chlorination itself basically is a way of disinfecting the water. Is a way of basically ensuring that there's no E. coli in the water. All right, we know that the water that comes out from the river, there might be a lot of E. coli. All right, E. coli is basically one of the organisms that can cause diarrhea. All right, and that is important for us to basically remove it. And chlorination is one of the things that is happening. So when the water reach our house, there is still some chlorine residue there, and the chlorine residue is to ensure that the anaerobic bacteria, like E. coli, or aerobic bacteria, anaerobic bacteria, do not thrive inside there, so that the water is still clean. So there are what we call chlorine residue inside the water that we breathe. So chlorination actually has reduced the number of people with typhoid disease, the number of people with what we call diarrhea diseases. So chlorination is one of the technology that's happening. Of course, currently, Mari Manapan says that they use more, basically not charcoal filter, they more use membrane filter. So there's a lot of studies or a lot of research being done to find the best membrane filter. And membrane filter basically is active filtration, all right, not a passive filtration. Right, this type of sand filter is more passive filtration, is by gravity. So gravity actually allows the the water to filter properly. But using a membrane filter, you need to actively energy is used to basically filter out. So there are different kind of filtration. So there's the filtration, right? So basically, you look at the technology, look at the improvement, look at even just putting chlorination into it. You basically improve the water quality and you decrease the risk of environmental health diseases. So that's why the problem of issue of chlorination is important. All right. This one, let's move this. Okay. So someone talk about food safety. All right. So we have this food issue here. It just arrived 2 days ago. What is your thoughts on this? Anyone? Have you read these two articles or some of these articles that came out 2 days ago? What's the thoughts on this? Anyone? What's your thoughts on this?
Hi, Prof. Adam
Yeah.
here. I
Yeah.
think based on my understanding, I think that food safety needs to be given more priority. In Malaysia, I think food safety engineering is currently rising up. Maybe before this, the issues were not that high. And maybe due to more food safety engineers, these issues arise because when they do the testing, they can see that there are some prohibited things inside the products.
Okay. And any other issue? So okay, Adam. By reading this, all right. After you read this, will you still continue to eat biscuit?
Not the one that they specify. Not all, but maybe the ones that they call out.
So you're going to stop. You're going to stop buying Hapsing product, is it?
Because currently I'm not eating, so it's not an issue for me.
Okay, so no worries. Adam, it's not an issue for you. Anyone eating Hapsing's product?
Me, doctor.
Hapseng audited by my company, Prof.
Why? Who? Sorry, who's it?
Lisa here.
Your what? What your company does? Sorry,
We audit as food safety, Hapseng.
you audit the food safety. Auditing. What is auditing? That's like the thing. What's auditing? All right. Is there a problem or not in Hapsing actually? Or is it overblown?
Alamak. No
No,
comment.
I'm not talking. So no. Don't worry. I'm not asking you to tell me what is the is that a
No.
problem in a sense. I don't think. Is you see, if you're talking about there's two issues here now. It's either you have failed, all right, because you audit and you did not find the problem, or after you audit the problem arise lah. So auditing has some limitation lah. So we will understand this in a more detailed manner lah. All right. So I'm not going to put you on the pedestal. That's why I say I'm not going to put you on the pedestal to shame you. All right. I'm not going to shame you for today. But looking at this, all right. Are you going to eat Hapsing product? Lisa,
Yes, Prof.
you're still going to eat Hapsing product. Very good. Anyone else?
Yes, Prof.
Me, Prof.
Prof, if I'm not mistaken, like past 2 years maybe, this issue come to viral when we need to take the biscuits and put on fire. So if the biscuit is burned and then we cannot eat, they at that time ada something yang viral about this. Yeah.
Okay, very good. Thank you very much. Anything else? Anyone else want to add? This is just came out 2 days ago. So 2 days ago, at least Adam don't eat biscuit. So very good, Adam. Adam, but you eat red meat, correct?
Red meat, yes. Yeah.
Very good. All right. Later, I will tell you what happened. All right. Anyone else? Anyone else that not going to think this is a problem and you're not going to buy housing product? Anyone else that eat housing? I eat housing actually. I eat the cream crackers that they actually were talking about. All right. So there's a cream cracker there. It's quite nice.
Hi.
Cream cracker.
Hi, Prof. Joyce here.
Yes, yes.
Just want to share. I eat a lot of hubs and crackers also, like actually almost every morning. But I think it's how much you consume, like because the concentration is only like how much milligrams per kilograms. So it's how much you consume and how much your body can like how do you say how much you consume and how much you expel out from your body. So how much is left in your body. So how that all affects the health. So I'm still going to eat it nonetheless. Yeah.
Very good. All right. Any other comment? Anyone else want to add to the discussion about housing product? What you want to do? Okay. Since no one want to talk, let's go and move the second one. All right. All right. Okay. Sorry, wait. This one actually is not new, you know. This is in 2019, so 2 years before that, the Hong Kong also makers also looking at it from this perspective. All right. So this is what they found. All right. They found that Hapsing crackers have 2,100 microgram per kilogram of the crackers. All right, contaminated, contains 2,100 microgram of glycidol. All right. And of course, there is also acrylamide, all right, 500 microgram per kilogram. So these are two of the chemicals. All right, these two chemicals, although they are hazardous, all right, as you say, but they are actually present. They're present in everything we eat. They are not just present. They're not just present in these crackers. They are present in everything we eat. So the keropok goreng that you buy, the goreng pisang that you buy, or the fritters that the banana fritters that you buy, or goreng pisang, and the crackers, the fried crackers that you buy, all right, do contains this because they use, most of the time they use vegetable oil. Any vegetable oil, basically there is glycol and acrylamide, all right. Of course, some vegetable oil have higher, some vegetable oil have lower. And basically, you must understand that when you talk about any vegetable oil, if you put it, if you fry it at a certain temperature, it will basically have these chemicals in it, all right. So that is the thing. So okay, if vegetable oil have the chemicals, so you don't take vegetable oil, is it correct? I tell you, all vegetable oil have this chemical if you subject it to a high temperature. If you cook it at a high temperature, of course, if you eat olive oil without cooking, there's no problem. But if you cook with olive oil, you still get some chemical coming out of this because it's basically part of the processing part of it. So all vegetable oil have it. Some have higher concentration, some have lower concentration. So, but if you heat it up, basically you will get it. Adam, you want to say something, Adam?
No. My computer suddenly restart. Sorry.
All right, okay, no problem. Anyone want to say something? So do you take vegetable oil or not? All right, so these are some environmental issues that you're going to face. Basically, there are chemicals all the time. There is chemicals everywhere. All right. So in 2018, the European Food Safety Authority actually revised the level of the chemicals that is basically can be present inside. Sorry, these chemicals. This is talking about glycol. All right, glycol, which is basically 2 microgram per kg of body weight from 0.8, and the joint FAO and WHO expert committee on food additive actually says it's up to 4 microgram per kg of body weight per day. So looking at it from the perspective of cream crackers of 2,100 what we call that, microgram per kg, and you look at the what we call that, the per serving. All right, let's say you eat one serving maybe consists of two pieces of biscuit. You're exposed to you usually consume only 31 gram of the biscuit. And 31 gram of biscuit, how much is 31 gram of the biscuit? How much what are you eating? Right? How much are you eating? How much are you exposed to? It's around 65.1 microgram, all right, of glycidol. So 65.1 microgram of glycidol, when you look at it, you basically, is it above the EFSA 2017 guideline? Or is it above the JEFCFA 2016 guideline? When you're talking about you are consuming one serving of the cream cracker, you're consuming 65.1 microgram of what you call that, of glycidol. Is it above the tolerable daily intake level? Let's say your weight is 650 kg. So you 50 times 4 is 50 times 4 is how much? 200, correct?
200.
Yes. So it's 200 microgram. So 65 microgram is below 200 microgram, correct? Even 50 times 2 is 100 microgram. It's still below 65 microgram. So there is an increase, all right? There is glycidol, but it is still within the safety limit. So sometimes when you read this article, when you go in and understand, is that basically there are biscuit, even we take all the processing into place, there are problem, but you also need to take into consideration of when we're talking about environmental health, when we talk about exposure, of course they are very sensitive. People are very sensitive to exposure, and people may look at it from different perspectives. But the more important thing that you need to understand is how much of what are you going to consider as dangerous, and what you consider as not a danger, and how do you defend your client. All right, Lisa, correct. How do you defend your client on that perspective? So is there going to be no glycidol and acrylamide in the biscuit? No, there will be, because they are using what we call vegetable oil as one of their processing chemical, as one of their fat substitute. All right, so it's called fat substitute. All right, so they use this as fat substitute. If you don't use vegetable oil, what other oil can you use? Animal oil, correct? But animal oil also has the same, what we call that, other health problem. All right, it can cause you to have hypercholesterol. So the idea is balancing between health and other issues. So the idea is when you talk about risk, which basically we're going to discuss later in other class, risk is not something that is just looking at risk per se, but you need to balance between the benefit and the consequence of the risk. So looking at this, all right, and think you're going to learn this later in your toxicology class, which is all substances are poison. There's none which is not a poison. The right dose differentiate between poison and the remedy. So it's important for you to remember this. This is the most important statement in occupational and environmental health. All right. Because if not, people would come and talk to you, and then you have nothing to defend on why you do something and why you allow something to be going on. We will discuss this in the next lecture on environmental health law. What are environmental health law, and why is environmental health law created, and what are we trying to do with environmental health law? All right. So those are the things we're going to discuss in the next class. All right. So of course, this is just to show you some occupations of environmental health problem over the last few years. All right. Even we're talking about COVID-19, water cut is there. Water cut in Selangor is basically not something extraordinary. It happens every 3 to 4 months, correct? If people are from Selangor, water cut do happen. And why does it happen? Because we have very old piping. All right. So when you talk about water delivery system, water that comes from the river, most of our water comes from river, and it needs to be, the river water needs to be processed and need to be stored and need to be delivered, and then only you get it. So any of those process is interrupted, you will get water disruption. All right. The main thing is, of course, you got not enough water in the reservoir itself. That's the main problem that we are facing currently because of the global warming, as you mentioned earlier. Of course, we have basically ammonia in water. So ammonia in water is another problem. All right. So what is ammonia? Ammonia is basically this is ammonia, correct? I think it's ammonia. Ammonia is basically a chemical found in when you mix your water treatment, when you have your sanitary landfill on way before your water collection point. All right. On this before your water collection point, then you have the problem. So the water collection point needs to be after. So the idea of when you're doing assessment of the water quality of a river, you need to look at the water collection point, and you cannot just look at water collection points that are used for water collection for municipal water, but you should look at water collection points that are used for water collection for industrial use also, or for other uses. So you need to include. So the idea is water collection point when the pollutant comes in, that's why it is a problem. Of course, we have global warming issue that cause flood in of course global warming, and also indiscriminate deforestation that we are happening. The continued indiscriminate deforestation that we're going to happen, that will be problem of mudslide and also problem of flooding. Why is the problem of flooding? Because when you deforestize the area, the water does not stagnate upstream. The water straight away flow like very quickly, and that's why there's nothing to actually prevent the water from flowing. If there are trees, there are roots that basically prevent water from coming down. So that's important for you. Deforestation is a problem. Haze is a problem. Haze continue to be a problem. All right, of course, because of the decrease in economic activity, because of decrease in industrial activity, in the past 2 years, we don't have much haze, and that's thanks to COVID. Of course, then you have what we call the freezing temperature, where because of global warming, the environment, the weather actually changes, and the weather changes. That's where you get all these issues. All right. And then we have chemicals in the in the plant itself. All right. So chemicals can come from and many things. One of the things, let's say you do fogging itself, it's a chemical. You do insecticide, it's chemical. That's why chemicals are the main problem. Then the rest is that water is the main issue that we're going to face. Lack of water, lack of drinkable water, lack of potable water, lack of surface water. So environment is basically anything that's external to you yourself, or to the animal is an environment. So an occupational is also an environment. It's called occupational environment. So specific to occupational setting, but environment itself is basically globally, it's called environment. So environmental health comprises of anything that a human do that basically going to be that the health of the human that is depending on the environment. What are the issues in the environment that actually can interfere with the health of the human? Can be physical, chemical, biological, social, and psychosocial. So it's the same thing that we study about occupational, the same thing that you just expand it further and look at it from the environmental perspective. The difference between environment and occupational setting is the exposure time. In the environment, you're exposed to it 24 hours a day, but in occupation, you're exposed to 8 hours a day or 5 days a week. The other differences is that one of it is voluntary, one of it is involuntary. Voluntary means that you are voluntarily going to work, so you're basically voluntary. Your risk is basically you know the risk and you just take the risk. But environmental health is basically a lot of time to do with involuntary. People are not able to change the environment because they have no ability to do it, and people cannot move to a better environment because they have no ability to do it. So it's all involuntary and they have to suffer because of the environmental degradation. So you can look at it from environment from many perspectives: total environment, behavioral, social, natural, physical environment. So everything actually comes into play. Everything is the environment, and everything actually would determine what an environment is and how an environment actually works. So interaction between environment, basically there's nature, human activities, physical and chemical activities, biological environment, and then there's an interaction, and the health is basically in the center of all these things. And you must understand that there's no way you can say that I don't want to degrade my environment, but I want to progress. There is, but it's very, very small. But of course, we can improve the environment by technology, by making technology work for us, and that is what we need to look forward to. Can you have a development, industrial development, residential development, a road development without degrading the environment? Yes or no? Have a thoughts about it, then come back to me next week. So the indicator of benefit environment effect on longevity and sustainability environment 2 degrees, right? Injury and death. Okay. So injury does not permanently end life. Death does. All right, this is okay. All right. So as I mentioned, physical, chemical, and biological environment, psychosocial, serological, and location where you stay is also a problem. You stay within a cyclone zone, earthquake zone, flood zone, hurricane zone, tornado zone, typhoon zone, and volcanic eruption. So what's the difference between a cyclone and a typhoon and a hurricane? Anyone? Can we have access? Can we have someone to come back to me and tell me what's the difference between a cyclone, a hurricane, and a typhoon? Is it okay? Anyone? Volunteer? Adam, you seem to be very, very free, Adam.
Can.
Adam, you're not doing anything, correct, Adam?
I'm Petronas Protege.
Protege, very good. Protege, you got 2 protege today. All right, so come back and tell me what's the difference between the 3. Next class.
Can, Prof.
All right. So physical environment, we include air, water, food, waste disposal, and shelter. Shelter is the environment. Shelter is an issue. Where you stay is an issue. How you practice environmental health in the where you stay is an issue. Congestion is an issue. Overcrowding is an issue. all those are environmental health issue. Although we might not think of it as environmental, we're just thinking of it as a what? None of you actually look at urbanization as an environmental health issue. Urbanization is an environmental health issue when a lot of people moving to the urban environment and there is basically more congestion, more overcrowding. That is an environmental issue. Biological, insect is a problem. We basically, animal is a problem. The SARS-CoV-2 is due to we encroaching on the animal environment and we are getting it. The Nipah virus is the same. The SARS virus is the same in Hong Kong. The first SARS virus in Hong Kong in 2004, 2003 is the same problem because we are encroaching into the animal environment. That's why we're getting all these biological issues that comes back to us. This is called we are not looking at it from the holistic perspective. We are just looking at it from the individual perspective. But there are the issues that we need to look at. Chemical, everything we do, we have chemicals. That's why we talk about just now. We talk about food additive. Is it an additive or not? It's a fat. All right. Can we take out the fat? Can you eat something without fat? Everything you eat, there are component of fat in it. It's either vegetable fat or animal fat. Right? There is fat because you need to eat fat. If not, then your food doesn't taste good. There are some fat in it. Minimum amount of fat is there. Any oil is fat. Any other fat is fat. So any kind of things is there's some fat component in it, and that is basically chemical. All right, all these are chemicals, and when you heat the chemicals, when you change the chemical, actually the structure changes, and some of it are cancerous, some of it are precancerous, and we will discuss this further when we look into occupational toxicology. Social environment, as I mentioned just now, your urbanization, your where you stay, what you do, what happened, actually it would determine your health. That's why I call social determinants of health, SDG, all right, sustainable development, all right. Occupational environment is an environment. As environmental health, basically we can look at it from environmental epidemiology, toxicology, engineering, preventive medicine, and also environmental health law. There's a lot of things to do with environmental health law, right? So environmental science study factor of environment affect human health, looking at pollutant and toxicant in the air and soil, transfer human by inhalation, ingestion, and absorption. This one we're going to discuss in details about how chemicals enter the body, how chemical is processed by the body, how we excrete the chemical. So these are all in toxicology and how it produces adverse effect. So whether there's adverse or benefit, acute or delay, clinical or subclinical, as we mentioned just now, there are basically healthy, latent disease. Latent disease are more of a subclinical component where they have no clinical symptom, but if you test them, you will find some problem and transient or reversible and irreversible component. The environmental factor, outdoor air pollution causes respiratory disease, selected cardiopulmonary disease, and lung cancer. So outdoor air pollution in the outdoor, and we talk about PM10, we talk about PM2.5. Right? What does PM10 does? What does PM2.5 does? Right? Why are we concerned about PM10 and why are we concerned about PM2.5? We will discuss this. All right. Indoor air pollution and solid fuel use. That's how I did mention about solid fuel. And we talk about solid fuel. Actually, we get a particular matter in the indoor, and it can cause COPD, lower respiratory tract infection, and lung cancer because of the what we call solid fuel actually contains PAH, all right, polyaromatic hydrocarbon. All right, PAH is basically one kind of carcinogen. All right, lead is basically a chemical and a metal, and that is where basically it causes mental retardation, cardiovascular disease, and also blood-related issue. Water, sanitation, and hygiene. We discuss this a lot. If you don't have clean water, you have diarrhea diseases. If your water is not, your recreational water is not clean, you get trachoma, schistosomiasis, acariasis, hookworm disease. Basically, these are all infestation by worms. Worms are present in the water that you basically your recreational water. So when you go for recreation, you must make sure that the recreational water is clean or not. A lot of people currently go and sit in the stream to eat. All right, but you must understand that you sit in the stream to eat, you're polluting the water because you're throwing back in the water. So whether that's climate change is a problem, climate change. What is climate change? What is global warming? What's the difference between climate change and global warming? Climate change basically causes diarrhea diseases, malaria, because of the change in the environment, change in the temperature. Your mosquito actually can change. And can you eliminate mosquito or not? Can you remove mosquito or not? Can you
No.
kill all mosquito? You cannot, correct?
Yeah.
What are you going to do? You cannot continue to fog every day. You fog just to kill all the mosquito. Can you do that? No, cannot. You kill the mosquito here, the mosquito will come from another place. All right, because they will migrate. So you cannot kill all the mosquitoes. So what can you do? You can reduce their breeding ground. That's all. Right? So mosquitoes, you cannot kill mosquitoes. You must ensure that so fogging itself, it doesn't work. Right? And then you get protein, energy, malnutrition because people are not have enough food to actually eat. So you get protein, energy, malnutrition. So these are the main contributing burden of disease in total population. So look at it. If you look at environmental issue, most of it is basically diarrhea diseases, lower respiratory infection, cardiovascular disease. All right. So the diarrhea diseases is basically clean water, respiratory infection, clean air. All right. So water and air is the main component of occupational disease. Environmental disease. That's why when you talk about doing an EIA, an environmental impact assessment, you look at water issue, you look at air issue. So water issue, what you look at recreational water issue, also water that's used for like the water collection point. All right. The other one is your air. So you look at what kind of air. So most of the time, basically, people look at what we call the PM10 or per particular matter of 10 micron. So that is the main thing that you look at. But actually, you can look at more than that. Right? So when you look at younger children, the problem is because they are more exposed. The more the issue, the more they get is the more diarrhea diseases. Younger children have more diarrhea diseases compared to older children. So basic requirement of healthy environment, again, is just simple: clean air, safe and sufficient water, safe and adequate food, safe and peaceful settlement, safe global environment. At the end of the day, we are not living in a village, we are living in a huge community, and we must learn to live with each other in that community. So we must identify vulnerable group that basically, as I mentioned, it's not that we want them to change. The problem of environment is that you cannot run away, you cannot change because you have no ability to do it. And these happen in basically vulnerable people, vulnerable group. These are more affected when there's environmental issue affecting environmental issue, and this is where they're affected from the environmental health component perspective. So you are environmental health professional, this is what you do. All right. So at the end of the day, how can we help to improve the situation in the environment by understanding what is important, by understanding how to do risk assessment, by understanding how to quantify the risk, and how to do an impact assessment. Then we will be able to do a better work and come up with a better prospect of ensuring that any development being done, any industrial work carrying on, there would be environmental would be the forefront, and that's how we improve the environment. Thank you very much. Thank you for listening to me. And any question before I close the class? All right.